Hey guys. So we're going to restart this and hopefully the connection is better. So we have Dr. Liza on today. And sorry about that. Anybody that's just signing in now, we're having connection difficulties. So I just restarted the live and hopefully the connection is better. Let's just see. Let's add Dr. Liza. Let's just see. We got to give it a minute now. Freaking connections. There she is. Okay,
There
I
we
just thought
go.
I'd
Okay.
restart it and see if that
Yeah.
fixed it.
Okay,
You,
yeah, you're good on my end.
yeah, you're good on my end. You froze too, and it was just like spinning and spinning, and I'm like, oh no.
Yeah, you froze on
Oh
mine.
no, now you're okay. You are freezing a little bit on me now.
Oh,
Let's hope that it doesn't keep doing that.
yeah, because now I took it off the Wi-Fi just to be safe.
Okay, yeah, you actually look a lot clearer. You were a little foggy before.
Okay.
Sometimes the Wi-Fi interrupts the system, which is so weird.
Yeah, so I just turned off the Wi-Fi on my phone and hopefully we're all good.
Perfect. So welcome, Dr. Liza. I guess we'll do like another little brief introduction. So anybody that's just joining in now, this is our second round trying to get on the live. We had a little bit of technical difficulties, but we're good now. And I want to invite Carmelia Ray, who is my co-host, but she's actually in Soho right now in New York. So I'm waiting to see if she's able to join in. It's going to depend on her connection. But until then, we will get started. And welcome, Dr. Liza. We were saying that her and I have had a past relationship. She's done some stories with Holler magazine. I would love to do some more things with you there in that space as well. And so we'll just start off by introducing who Dr. Liza is. She is a fascia so let's start here. She is a fascia and posture expert, osteopath practitioner, author, speaker, and founder of the Fix Healthcare in Toronto. She has a shoe line, compression socks, and purses I think I've seen.
Yes.
So we're going to cover a lot of things today. We're going to talk about the missing pieces to pain, posture, aging well, fascia explained, perimenopause, menopause, pain, why the symptoms get worse in this stage of life, tips and tricks of what you can do to help that. We're going to talk about the fascia connection to pain, hormone, stress, women's health over 40, how trauma, stress, and fascia affect your health more than you think. So welcome, Dr. Liza.
Thank you for having me. Looking forward to
Yeah,
this
you're
chat.
so welcome. You've been in this space now for quite a long time.
Yes, I mean I've been in practice for 20 years now, so yes, it's
Wow.
been quite a while.
That's amazing. And so what is it you're focused on mostly right now you're finding with your patients?
I mean, I really do think that fascia is the foundation of a lot of what occurs in our body. And
Yeah.
given that I see people for aesthetic reasons, as well as pain, inflammation, posture, recovery, it all goes down to the fascia. So if I had to say what I'm focusing on, it really is the fascia. Because even with my
Yeah.
shoe line, that's supporting the fascia. With everything I do, it's really supporting the
I
fascia.
love that. I figured that. I knew there was an angle with your shoes. I was like, these shoes are for back and posture and fascia. Like I had this idea.
Absolutely.
And it's funny because lately I've been seeing a lot of ads on YouTube, especially about women holding trauma in their fascia and in their especially hip area and giving these little exercises to see if you are in fact holding trauma in that area. And I kind of wanted to talk about that a little bit because I actually tried one of the exercises, and you lay on your back and you bring your legs up and then slowly release them, and they shake. And if they shake, then it means that your fascia is or that you had trauma that's stored. Is that true?
Absolutely. So actually, this is the first time that I was made aware of how important fascia is and that it can actually store trauma was quite early in my practice. So I'd say in my first year in clinic, I
Yep.
was seeing a patient and she came in for lower back pain. And I said, we're going to treat your hip flexors because the hip flexor muscles, those are really key in a lot of back pain patients because
Yeah.
it attaches to the hip and then attaches to the back. So that's often one of the first things that I release. So as I started to release that area, she started bawling, her legs were shaking, and I thought, oh my gosh, sorry, is that too much pressure? And she's like, no, she's like, I don't know what happened, but just something came up. And she's like, it just flashed back to me being sexually abused as a child.
Yeah.
And so then I thought, oh wow, because before then I didn't really know the connection between fascia and emotions. Fascia wasn't really talked about back then. And
Yeah.
that's what led me to start researching into fascia and how it's a storage system, especially for childhood trauma. Because when you experience something as a child, your brain and nervous system aren't actually completely formed yet. So your body doesn't know what to do with that trauma. So what it does is it actually stores it in your fascia, which is what they call like a rudimentary system where it stores a lot of what the brain and nervous system can't handle. So think of it as your
Right.
storage drive. So then when
Right.
you go in and release that fascia, those repressed memories or trauma that happened previously get brought to the surface again.
Yeah, that's amazing. And so, do you work on a lot of patients in that space? Like, I actually, not that I don't have any of that kind of trauma, but I'm sure all through my years, like, because trauma can come in so many different forms, that you should have that released.
Absolutely. And the thing is, when people come in to see me, they're not coming in to see me to say, oh, I'm here because I want my trauma released. They
Right.
come in for something else. So, for example, a woman might come in and be like, I've noticed that my face has been rapidly aging. Like it seems like it's sagging. I have
Yeah.
these deep lines. And I'm like, oh, so when did that start? And then they'll tell me about a traumatic incident, and then that's when we start working through the trauma because I'm like, it's a trauma that actually brought you in here. It showed up in your face. And oh, you
Right.
also have hip pain, you also have foot pain. And that all goes back to this history of trauma. Or someone might come in with, they're like, oh, my shoulder, like I always feel like my shoulders are super tight. They're at my ears. It must be just, working at a desk or computer all the time. And then as
Yeah.
we start to release it, other things come up and they're like, oh, like I've been carrying a lot on my shoulders, like emotionally, I went through this stressful thing. And after our last visit, I just felt so much lighter, like a weight had been
Yeah.
lifted off my shoulder, but not just physically, emotionally. So
Yeah.
people come in for all sorts of things, but then a lot of time it goes back to like what actually caused it, like what was the reason. Sometimes it's classic. You have like a physical injury, like you had a fall, or this is a sports injury, or you do work at a desk too
That's
much and didn't
right.
tighten up. And then sometimes it's like a toxic relationship. Oh my gosh, my boss is super controlling and my manager is micromanaging me, or
Yeah.
I had an argument with a friend. And then those are the things that they realize after we treat them that I'm like, that's what was causing it, not, using my phone too much.
Right. It's so true. Like, I feel like so many women nowadays, that we're talking about that more, which is so, and men too, like, because like we said, trauma can be for anybody, but especially women. And like, I wonder if there's a connection between like endometriosis and all of these different diseases that are coming within the women's bodies, because there's so many things that are happening now to women. And I think a lot of it is caused by suppressed emotion, you know?
Absolutely. So you mentioned endometriosis as
Yeah.
one. So when you think of what endometriosis is and it's uncontrolled like fibrous growth, right?
Yeah.
When you think about fascia, same thing. So when you have all these things that are being stored by the fascia. At a point, your body says, I can't just keep storing this. How is it going to
That's right.
manifest itself? So it can manifest itself as, I'm going to tighten up those hip flexors and you're going to get back pain. But it can cause other things as well. So possibly endometriosis. You have
Yes.
many cases of patients who can almost link the type of cancer they had to the origin of fascia. And there's research being done currently that's associating different types of cancers to fascia and how people are storing those things in their fascia that later leads to the uncontrolled growth of the cells,
Yeah.
and that is cancer. So a lot of the diseases, disorders you're looking at where you say, we talk about how stress can kill you. Being
Yes.
in a toxic relationship can lead to autoimmune disorders.
Yes.
But, what links our immune system, our lymphatic system, our physical system, our emotional storage? What links those all? It's actually our
Exactly.
fascia, because that's a connective tissue that literally connects everything in our body, from our nerves to our viscera to the cells, and kind of calibrates everything. And if you're not dealing with something and you're repressing it, where does that go? It doesn't just disappear, right? So it gets
Exactly.
stored in your body. And women
Yeah.
often say, oh, I don't have time. I'm worried about other people. I'm going to just store it in and then just keep on going.
Push it down. Push it.
Exactly.
Put
Where
it
are
in
you
the tickle
pushing it?
trunk.
Yeah, where are you pushing it? Where are you storing it?
Right.
In
It's
your
so true.
vessel.
And like people always say, "Oh, you know what? I can't. I don't have time to deal with this right now." And then they push. Well, that tickle trunk gets fuller and fuller, and then the top starts popping off, and things start spewing out. And
Absolutely.
right. And it's crazy because like I always tell people in like my field of work, that their body symptoms are a way of their body and their nervous system and what's going on trying to communicate, because your body can't do it any other way but through symptoms. So people try to treat their symptoms instead of the underlying cause, which I think is what you specialize in, is getting to the root of the cause of these problems.
Absolutely. So that's the key part of it. The symptoms, while they're important because that's what you're feeling, those oftentimes don't give you a true picture of what is actually happening in your body. Because,
Yeah.
like, look at something as standard as back pain. There are so many causes of back pain. So, is it the emotional stress, right? Is it a car accident that you had? Is it a sports injury? Is it sitting too much at a desk? Because
Right.
that also determines how you treat it. It's very different if something is based on, it's like, oh, if it's a back injury, you might have to strengthen your core and do those sorts of things. But now, if this is due to emotional stress,
Yeah.
then it's the fascia that you really have to target. And you might have to target that with psychotherapy as well, so that as that is getting released from the fascia, you're also working with a therapist in order to address what's being released.
Yeah, exactly. Oh my God, I love that. And the beautiful thing is that you do all of it.
Yes. Well,
Yeah.
I mean, I'm not a therapist, but the thing is, I have done a lot of training in trauma counseling. So I am a
Right.
certified trauma coach as well,
Yeah.
because when you are the person who is releasing fascia and releasing all this trauma, you do have to be well versed in talking it through in order to
Yeah.
make the association. So I
Exactly.
need to know when I'm working with a patient that, you know what, it feels like what you're going through is possibly narcissistic abuse, and that might be what's contributing to this. And
Yeah.
then directing them, say, you might want to speak with a psychologist, a therapist, sometimes even a psychiatrist, in order to have well-rounded treatment for what you're going through.
Yeah. Yeah, it's so important to take care of your emotional health, because I think for years people didn't, and now is when their symptoms are screaming and they have no other choice but to do so. And I'm glad that the world, as much as the world is changing in a crazy rate, and some good and some bad, I feel like people are evolving so much and they're really taking control of their health, not just like by what they eat and their exercise, but the deep, deep control, like, you know, like the emotional and the physical, the mental, the spiritual, all of those things seem to be such a big forefront in people's lives now, which is so great.
Yeah, I think so, because there's more online on social media sharing their stories and their experiences,
Yeah.
and people can relate to that and say, oh wow, I heard this podcast and this lady was talking about where her back pain came from, and I'm like, oh my gosh, maybe that's where my back pain came from too, because I can't think of any other reason why I would have that. But yes, I did experience this,
Yeah.
and it didn't, the link didn't even happen, because if you see a practitioner who might not be trauma informed, or who might not be, someone who works intimately with the fascia, they may not know that. So you might be going for physiotherapy, you might be seeing a chiropractor, and they're just doing standard treatment, and then you're not getting better. And there's
Yeah.
another layer, but then you say, oh, wait a second, I watched this video on TikTok, and she had something similar to me, and she said she went for myofascial release, and that's when she realized what was actually causing it. And then those people will end up in my office because they're like, oh, hey, I don't
Right.
need.
That's why, and honestly, oh, Carmelia's trying to join. One second here.
Okay,
And
well,
that's why
welcome.
I wanted to do this, because I feel like so many people need a place to go. And that's kind of why I started this podcast in the first place, was because I felt like there's so many issues with hormonal health and women over 40, and they don't know where to go, they don't know what to do. And so I've been really trying to focus on all the aspects of women's health, mind, body, soul, and the connection to it all, and give them places and people they can trust and information that they can use that will help them, get out of their trauma or fix what's going on. So this
Yeah,
is such an
especially
yeah.
Yeah, especially with what you're doing and trying to change women's bodies. A lot of people don't know that there is such a close link between our hormones and our fascia, and that
Yeah.
the health of our fascia can actually determine, and oftentimes does, determine our levels of certain hormones. And then vice versa, certain hormones will affect the health of our fascia. So when we talk about perimenopause and
Mhm.
menopause, those are periods of time where estrogen is lowered. So when estrogen is lowered, our fascia
Mhm.
actually has less collagen. So since
Ah.
collagen is a big component of fascia, when it's lowered because of reduced estrogen, our fascia ends up being not as tensile, not as strong, and that makes you more prone to injury. It means you're going to have more pain and more inflammation. And when they've done studies where they've given women birth control pills which
Yes,
contain estrogen, their rate of inflammation, pain, and injury drastically reduced.
it does.
Because,
Yes.
yes, because now when you add in the estrogen, our fascia is like, thank you so much, because now I can produce more collagen, and
Yes.
that's going to create more strength in the fascia. But that's also one of the reasons why you find that women, when they reach perimenopause
Mhm.
or menopause, they may feel like their emotions are out of control,
Yeah.
right? So if you've had this storage system, your
Hmm.
fascia, that's been carrying all of this for all of these years, and now a drop in estrogen is causing that fascia storage bank to weaken, some of what has been stored in that fascia is now going to start to leak out. So
Right.
now, say you've been autistic your whole life. Now, where that's dropped, you're not able to mask anymore, so you're doing that. You're exploding at people. You want, you're you can barely tolerate your partner breathing, right? And it's
Hmm.
because all of this that you've stored in there, that bond that holds it together is now weakened. And that's why a lot of women, when they go on hormone replacement therapy or they start with estrogen creams when they're in, they start to be like, oh, okay, people are more tolerable. Humans are not so
Yeah,
bad.
totally. And HRT is a wonderful thing. Like I actually my estrogen is actually really high,
Okay.
and I had endometriosis, and I ended up having a partial hysterectomy because of the endometriosis. This was 2 years ago, but when she went in there and did the scope to find where it was actually on my pelvis and my bladder.
Okay.
So it was removed from all of the areas. But it's crazy because like all of these symptoms I was starting to experience, and this was like when I started to really experience the perimenopause symptoms. My blood work says that I'm not near menopause yet. And it's strange because usually it's the opposite, like your estrogen will decline. And mine's the opposite. My progesterone was lower and my estrogen was super high, which again feeds the growth of endometriosis.
Yes, because when we think about it, because remember, when you have increased estrogen, you have increased fasciocytes. So you have increased growth of the fascia, which is this fibrous tissue.
Yeah.
So that increased estrogen is going to promote the growth of that tissue. And that's one of the
Right.
reasons why with endometriosis, you might have an increased expression of estrogen because estrogen increases fibrosis, right? And that's
Right.
why as you get older and you have less estrogen, that can mean you have less strength in your actual fascia. So
Right.
it's an interesting thing where you can actually have increased fibrosis or storage in the fibrous tissue from trauma or something else. And then
Mm-hmm.
because of that, your body, likes to keep things in balance. So it's like, oh, look, she has lots of fasciocytes. She has lots of fibrosis. Therefore, to balance it out, she should have lots of estrogen,
Right.
right? So your body's in this constant state where even for your posture, for example,
Mm-hmm.
when your posture is open, which means your shoulders back, you're standing upright, even just 30 minutes of this, your testosterone levels will go back, will actually increase 10%. And the reason that they're increasing is because your hormonal system is like, oh, the fascia in these certain areas has extended, and that's indicating to us to produce more estrogen. So it's like, oh, and you have more fascia in these areas and it's proliferating, that means you should have more estrogen. And it's this constant balance, or even with poor posture. So like when you're scrunched in, your shoulders are tight, your body's like, oh no, the fascia is restricted in these places. She's not in a good place. We're going to bump up cortisol. So that's why
Right.
oftentimes you can see people when they have poor posture, when they go and try to lose weight, they have difficulty because with
Yeah.
that poor posture, your body is literally producing more cortisol. When it produces more cortisol, that sends a feedback back to the fascia, and it's like, oh, I'm going to close it even more. And when
Right.
we think about where fascia actually holds things in, like it's literally the thing that holds everything together. If I were to remove all the bones from your body, you
Yeah.
would still keep your exact shape because the fascia would hold it together.
Wow.
And then when you look at fat in your fascia is actually what's holding that fat together. So now, if that fascia becomes tight around the fat, your body says more cortisol, but then also it's also telling your body we are holding on to that fat, which is why it's giving the cortisol. So now when you're trying to lose weight, you're eating less, you're working out, you're doing everything proper,
Exactly.
and then the fascia is holding on and saying, I'm not letting any of this fat go. And I'm going to trigger the hormones to reinforce that.
Yeah,
We don't want that.
exactly.
So that's
Right?
how important the
Make
fascia is.
Yeah, that's amazing. This is so interesting because I know like I work with hormones and stuff, but I never understood till now the connection between the fascia and the hormones and everything. It's just that amazes me.
It's so remarkable. I mean, I saw a patient, she first started seeing me, gosh, I guess it would be about 4 years ago now. She came in for, severe sciatica. We started working, we started releasing the fascia, balancing everything. And after our first visit, she said she had tremors for 6 hours. Like
Wow.
she was just shaking. The next visit, same thing. She had it, but maybe for 2 or 3 hours. And then over the course, she's like, I feel like so much has released from my body. And she had so much trauma that in the first 6 weeks of our treatment, like, and mind you, we were focusing on myofascial release. After 6 weeks of treatments, she had lost 20 pounds. She was just like, she's like, I mean, I'm walking more, so maybe that's it. But she's like, I'm not walking that much, but maybe because I'm moving more, I'm like,
Her
whoa,
body
like,
felt safe.
yes, to let it go because it had been
Yeah.
holding on to it. Because I'm like, she didn't change what she was eating. And like, she's not a physically active person. I'm like, you didn't walk that much to lose 20 pounds in
Right.
6 weeks. It's just all that shake, all those tremors, that was your body releasing the trauma. And then it's like, you don't have to carry that extra weight anymore. The fascia was like, let it go. And then she started sending people to me for weight loss. I'm like, no, it's not. I'm not.
That's
Weight loss.
amazing.
Not a weight loss thing. I'm like, this is specific to you. It depends on what the person is coming in for. So I can't just, myofascial away everyone's fat. It's about
Right?
you restoring that because of your trauma.
Yeah, exactly. But I mean, I bet you that's for a lot of women.
Yeah, a lot of women who are overweight. I mean, it's hard
Well,
to
and
find someone who's even obese who doesn't have trauma. They always go hand in hand.
exactly. And I mean, weight issues are a lot deeper than just weight issues. It's a lot usually emotional trauma that caused the weight issues in the first place. And
Absolutely. So it's not really just about calories in,
that's
calories
right.
out. When it comes to women and our hormones, especially, it's
Yeah,
so much more than that.
it's so true. And so let's talk a little bit about perimenopause and menopause pain and what women can do about it and some of the symptoms they might not recognize that is that.
So for a lot of women, because when we talked about how your estrogen drops during perimenopause and menopause, that affects the health of your fascia. And there's certain areas where women have stored more in their fascia over the year, so you tend to notice that more. And two big areas are actually the shoulders and the hips. And that's why I'll see a lot of patients who will have frozen shoulder that they're like, this came out of nowhere, or they'll have hip pain, hip discomfort, and we see, all these hip replacements needing to happen. And a lot of it is because of those changes that have happened with the estrogen and the fascia in those key areas. And then
Right.
once you have the fascia changing in the shoulders and in the hips, that's going to affect your knees. It's going to affect your feet. A lot of women
Yeah.
will end up with plantar fasciitis because at the bottom of your foot, you have a thick band of fascia, right? It used to be really supportive. It's what made up your arches. Now,
Yeah.
if you're losing the collagen that supports that fascia, your arches will also start to fall. So that's why you have women as they get older, they lose some of the fat pad in their feet, their arches start to fall, they get plantar fasciitis, and they get more foot pain because they're
Yeah.
losing that support that those strong collagen fibers had in their foot. So what can you do about it?
Get your shoes.
Yes. Number one, get Dr. Liza's shoes. But first, I mean, you need to really pay attention to your posture because
Yeah.
if you are in poor posture, so say your shoulders are rolled forward, your hips are tightened in from sitting too much,
Yeah.
then those fascia in those areas that are already shortened because of poor posture, they're going to get weaker and tighter.
Yeah.
So if you can focus on your posture, focus on the health of your fascia by staying hydrated,
Mm-hmm.
taking collagen supplements, Movement is key. And one
Yes.
of the biggest things you can do for your fascia is setting boundaries. So some of the
Love that.
worst traumatic cases I've seen that have had the biggest effect on women when they enter perimenopause and menopause is actually a toxic relationship.
Yeah.
So if you can have very clear boundaries where whether it's, you know, a toxic romantic partner, a toxic friend, if you can be very clear and able to remove those people by having clear boundaries, that can save you so much grief in your fascia. It can actually save your life, right? Because
Yeah,
if
I
you are
agree.
holding on to that toxic person can literally kill you.
Yeah.
So I would say that's one of the biggest things you can do to prevent the pain. But all those little things, like I said, staying hydrated,
Yeah.
vitamin C, collagen, movement, stretching, focusing on your posture, those will go a long way in helping to preserve your fascia and to prevent things like frozen shoulder, the hip pain,
Yeah.
and fascia just for exercises, wearing Dr. Liza
Yeah.
shoes or any orthopedic shoes.
Exactly. Yeah. And like, I'm interested to hear about your shoes too. We'll kind of just, briefly go through that at the end too, because it's like I myself have naturally a flat foot, and I've always had that. And I wonder if it's gotten worse over the years. I don't have foot pain, but my what are they called? The bunions or
Bunions, yeah.
yeah. So, and I know I abused my poor feet back in the day, and I wore high heels that were like this. So I know now, like I had to kind of restructure my shoes, so I started wearing inserts,
Oh, perfect.
and really made a big difference in the like this like the placement of my foot in my shoe. And I noticed that bunion is kind of straightened out a lot than it used to be.
Yes, because having the right support with orthotic
Yeah.
insole makes a huge difference because over time, as I mentioned, your arches are going to be affected. Just, also wear and tear, you're on them for your whole life, right?
Yeah.
So, you know, it's not cheating to get that support back by using orthotics. Not
That's
only
right.
will your feet thank you, but your knees, your hips, your back, all
Exactly.
your weight bearing joints will feel so much better when you're in alignment.
Yeah.
Because whether you like it or not, no matter what you do, no matter what exercises you do, your body's going to change. It's going to suffer from wear and tear. So there's
Hmm.
things that you can do to support that. And wearing orthotics is one of the easiest ways to do that.
Yeah, yeah, yeah. It's crazy. The body for sure keeps score,
It absolutely does.
doesn't
Very
it?
good score.
Yeah. And we see all of that receipts coming out as we get older.
Exactly, because it's just accumulation. So that's why it's better to have daily routines and daily habits. So your body is just going to keep track of stuff that you're storing. So
Yeah,
if you're not storing stuff, then it doesn't have to keep track of that stuff. So
exactly.
with your activities, break it up every day. Stretching releases a lot of that. Activities
Yeah.
like dancing, tai chi, those
Right.
release. Having just a daily routine where you're just releasing what you've been holding on to, whether it's meditation, movement, having something
Yes.
daily in order to, lessen what your body has to tally up and save that for the really, really bad things, not all the daily little things accumulating.
Yeah, 100%. Like dancing, like you mentioned, that's one of the best things I think too. And there's this Mike Chong. I don't remember the name of his type of exercise that he does, but it's basically like jumping up and down, like just like 5 minutes in the morning, where you kind of jump up and down, and then you slap your body all over, and you kind of like do just like a funny little movements, and you slap your hips, and it's so funny because after I've tried it a couple of times, and I'm like, you feel really like loose, and it's like his way of moving your chi. Like he said,
Yeah,
everything gets stuck, and it doesn't matter what form of exercise you choose, as long as you choose something to move that energy throughout the system.
exactly. And that stimulates your lymphatic system as well, because your
Yeah.
lymphatic system is literally what's responsible for moving toxins and waste out of your
Yes.
body. So if you are moving your lymphatic system well, you'll have less inflammation and less buildup, because a lot of disorders or things that you get as you get older are a result of buildup in your body. So
Yeah.
if we look at something like Alzheimer's,
Yeah.
when they look at the brains of people with Alzheimer's, what they see is buildup of metabolic byproducts. And then one of the more recent discoveries that they found, and this was actually a study that was done 3 years ago in China, where they had participants who had Alzheimer's. And what they did was they just made a tiny incision to promote lymphatic drainage from the brainstem. And I believe there were 37 participants, and
Yeah.
100% of them, so all participants, had their Alzheimer's reversed by this procedure. And then we had a
Wow.
study the year after where they developed this activator tool that, it's manual therapy, and it was also used to encourage lymphatic drainage. And in that study, they also showed vast improvement in patients with Alzheimer's. And then after that study, I thought, okay, great. So let me try this with some patients. And
Yeah.
so I had a patient who has Alzheimer's. And so we started doing work in those areas that they did in the studies as well, just with manual therapy, myofascial release to promote lymphatic drainage. And at first, when I would see him, the next time I would see him, because we were just doing once a month, he would tell me the same stories, and just like, yes, yes. And then by after a couple of visits, he would start to tell a story and be like, oh no, I told you that story last time. And he would start remembering what happened in our last visit, which means that his short-term memory was coming back. And I thought, so lymphatic drainage is amazing, and your lymphatic system is also bound by your fascia. So the
I
lymphatic
figured
system
that.
and the fascia are intertwined. They're working together. So that's why with the movement that you're doing, you're like loosening up the fascia, and that's why that slapping that he's doing is also helping.
Yeah.
It loosens up the fascia and promotes lymphatic drainage.
Yeah. I think it's called Qigong, or Qigong, something like that. If people want to look it up, it's really like extraordinary how much that helps, with your lymphatics and your energy and all of those things. I guess because we're really essentially just one big energy ball.
Yeah, we are. And a lot of that energy is held together by your fascia. It's not all of it.
Yeah, exactly. It's amazing. The human body fascinates me.
Yeah, it's fascinating.
It's fascinating. I love that. Oh my God. Hashtag. We need to put that on you.
Yes.
You are fascinating.
Yeah, that's it.
I love that. So, why do you think that over 40 is when we all start, noticing all of these changes, like the pain and the aches and the inflammation? And is it like you mentioned, like just wear and tear over the years?
I wouldn't say it's just wear and tear over the years. I would say a lot of it is due to hormonal reasons.
Right.
Because remember, you'll have people who are 40 and don't have any aches and pains and are perfectly fine.
Exactly.
And then you'll have someone who's 30 and entered perimenopause early, and
Exactly.
they're falling apart. So
Yeah.
of course, wear and tear plays a big part in it, but we can't just discount why all of a sudden, especially for women with perimenopause and menopause, why the ache's starting to boom up, and that's largely tied to hormonal reasons.
Right. Yeah, it's crazy. Like I have so many clients and some of them are in their 30s and they're lost their period. They have so many symptoms. They are just, in a really bad place mentally because of where they are, like you mentioned, with their hormones declining. You get irritable, you're cranky, you're short with people, and to see that happen at such a short or young age is so sad.
Yeah, and it's when things catch up, right? Because think about it, if you experience some form of childhood trauma, and
Yeah,
when we think about childhood trauma, we're not just talking about, like sexual assault or abuse. There's other things. There's neglect, there's having a narcissistic parent, there's being bullied by other kids. So there's so many different things. And when you're a child, you don't have the capacity to deal with it. So that's all
right.
stored away. So then, as you get older and those hormone levels drop, again, we've stored that in your fascia. You've been holding it in for so long. So at a point, it's like the straw that broke the camel's back. It can just be one trigger. Like someone can just say something to you and that takes you back there.
Snap.
Yeah. And now all of a sudden you're like, oh my gosh, my hips, my back, oh my gosh, I have headaches, I have migraines. Where did this all come from? My life is falling apart. But I'm like, it's been there. It's been in you, right? It's just your body said, enough.
Yeah.
I've reached my threshold.
Yeah.
The storage drive is full. So now you're going to have to feel all that you've been storing away. Yeah. And that's why, practices like, actually going in for treatment, getting fascia, yoga, things that release that are so key, especially when you start to get into that age where your hormone levels are changing.
100%. What do you think are some like physical signs that women might not recognize as emotional stress that is trying to get them to, do something and help themselves?
So the biggest one I see that people don't notice is actually changes in your face, right?
Wow.
Because whenever you have a feeling or expression, you convey that as a human through your face. So our emotions are closely tied to the fascia in our face. So it's the fascia in our face that gives us our appearance and determines what we look like. So when you start being like, oh gosh, I need Botox, or look at these bags under my eyes, or why is my face sagging? That's actually your first indication that emotional stress, because aging doesn't happen overnight. So it's just like when you look in the mirror and like one day you're just like,
what the hell?
Whoa,
who am I?
Yeah, that's your first indication that's like, okay, maybe there's something off with my fascia. The next is where you just start aching. You're like, it doesn't take much, and it's like your hip goes, and then your knee goes, and you're like, oh, and now it's my foot. It just seems like it's a revolving door.
Right.
It's like, why all of a sudden am I getting headaches? So something new out of a sudden.
Yeah.
Those kind of things can indicate that it's your fascia. But it's interesting that the face, because so many women, when they come in to see me for my face fix, because I have a signature myofascial release treatment for the face.
Really?
So they just want to look better.
What does this look like?
Oh, so just think of, because with myofascial relief, think of like deep tissue massage. So this is releasing all the areas in the face where you store everything.
Oh, I love that.
Yeah, when the fascia is tight, it kind of pulls everything down.
Yeah.
So then as you release it, it kind of just pops back up. The glow returns. I've seen people's eyes start to literally sparkle, and all these imbalances are corrected. And then when we get down to it, oftentimes it's like, well, this is the reason, and we get to the trauma, and then we start working with the rest of the body as well. But that's probably the treatment option that brings in the most trauma patients, is literally the face fix, because that's what brought them in. It was
that's it. Yeah. So what about using the gua sha? Is that like a kind of similar at home style?
Yeah, so as part of my face fix, so I start off with the manual myofascial release, but then I also do facial cupping, I do gua sha, I do rollers, and then I do some osteopathic manipulation. So the gua sha is one of the tools that I have my patients do for upkeep, so that they can maintain their treatment and keep that fascia loose at home. So that's an easy, nice tool to have at home. So fascia and some good facial oil, and we're good to go.
I love this. I feel like we're going to have to do a visit, and I'm going to have to do a story on this and go and actually have you do it and show people.
You'll love it. It's obviously the best treatment ever. Like if I could do it if I had someone who could do it for me, I would do it every week. It's the best.
Right? I love that because so the funny thing is I find, and I know we have so many trigger points in our feet, our hands, our face, our hair, our head, all of that. And it's like I love a massage in general, but there's something about the face when you get your face in, because my massage lady will sometimes do like parts of my face, and I'm just like,
Oh, the face
I'm
massage
so
is
like melted.
so good because you just hold every time you've been angry, every time you've been
Yeah,
upset, you've expressed it on your face. That's literally all in the fascia in your face, which is why the
right? It's
release of that
wild.
fascia is so therapeutic. And so not only do you
Yeah.
feel great, you look great
Yeah,
after.
exactly. Oh my God, girls. Okay, the new Botox fascia face
But
release.
yeah, but better than Botox, right? Because unfortunately with
Better than
Botox,
Botox.
yeah, you're actually preventing the fascia from moving, which
Yeah,
means that you're not giving your brain feedback. And so then over time, your brain says, well, I'm not getting that feedback from you, so I'm going to start losing those emotions. And so you lose the highs and you lose the low lows emotionally, and you enter more of a, you can't be as happy. You can't be as angry. Your body's like, we don't know those emotions because you don't express them fully
exactly.
anymore. So if you can do it naturally, it's always a better idea.
Yeah. And I notice like sometimes too, if you're having a bad day or, like you go for a drive and someone cuts you off or something happens and like a few things now pile up that happen. Um, you you can feel it in your forehead, like it's like your face is
Yeah.
like holding on so tight. And it's like when you just take a deep breath, and I always tell people that when you have a moment, just take a nice deep breath. You can almost feel it when you breathe, just releasing and slowly. So I can't even imagine what this must feel like to have that fascia release. I'm so excited. I'm
Yeah.
definitely going to come and do this because,
And the breathing out, that is a great tip. Because
yeah,
also, like, 'cause driving in Toronto, I mean, sometimes I just feel myself just tensing up and I'm like, it's not worth it.
no,
Breathe it, let it go
right?
because you don't need them to make your eyebrows tight. You don't need them to, hold that energy in your face. So I'm like,
Exactly.
just breathe, let it go. Karma will get them for
It's
whatever
so
you do.
true. It's not worth the the damage that holding on to that moment of stress is going to do long term. And I think that's something too we get better at as we get older, because as much as there's things that happen negative as we get older, there's still a lot of great things that happen by getting older too. And that's one of them I love is the fact that I feel so much more balanced and at peace within myself, you know?
Well, which is amazing. But the thing is, you've learned, you've implemented practices so that that's
Yes.
the way that you act. But you'll be surprised to know that you are not in the majority at all. So
No.
most people, as they get older, they don't become more at peace. They actually become angrier, right?
Wow. I'm
And
so
they,
glad to
yeah.
hear this.
So yes, you are an exception. Because the thing is, if you didn't learn the habits to
Yeah,
implement, and if you're not, you have things to release, like you work out, you're active, right? So you have these
exactly.
releases, but people who have just pent up all this stuff their whole lives and don't have any releases,
Yeah.
oh no, they become more chaotic as
Honest to
they get
God, I
older,
never
not the
think
other way.
about that, right? And I feel as much as the exercise and eating healthy is so important, I really implement breath work and meditation, even if it's just a couple minutes each day. And it's really changed my energy, my tolerance, my like the peace I have and feel within. And I think when we have that, a lot of things change. Like, what would be the connection between fascia and breath work and meditation?
So when you think about every time you are breathing, so much of your fascia actually has to be able to expand for you to
Right.
breathe. So you have fascia around your lungs, you have fascia in between each of your ribs, you have fascia around your diaphragm. So every time you inhale and exhale, that fascia literally has to move and then bring you back. So
Yeah.
when you have someone who has anxiety, for example, And I go into the fascia between their ribs, the fascia around their chest, the fascia between their shoulder blades. It's always rock solid and crunchy because they've been
Yeah,
holding that in. And when you hold it in and then your lungs can't fully expand, your body, it sends a signal back to your body saying, oh my gosh, my fascia in this area that's so essential for me to breathe cannot move. And so then your body says, oh my gosh, and it produces a lot of the hormones that contribute to anxiety. So
right.
our breath is so important in helping the fascia to move. So when we talk about breathing exercises, focusing on our fascia and meditation,
Yeah,
those are intertwined. So with any stretch, I wouldn't have anyone do stretches without them breathing, giving them breathing cues for that stretch. Because just going into a stretch,
that's
that's
right.
not going to, that's not going to help you. I need you to breathe correctly for that stretch so that,
Exactly.
because we're not just concerned about the muscle
That's
stretching,
right.
we want the fascia to stretch. The fascia is not going to stretch if you're not giving it the proper breath to go with it. So breathing, fascia, so important for your health, so important for your body.
It's so true. And I have in my program, um, I created a method that I call MSB, and it's
Oh,
mind, soul, and body, because I think weight loss and hormone balance is so much more than just exercise and nutrition.
absolutely.
It's creating that connection, that like orchestra of everything working together and synergy. Because our breath is like our most, like our heartbeat is our most reliable like rhythm in our lives, and if we're not doing something for that, and it doesn't take hours a day. Like people think, oh, I don't have time to meditate, I don't have time to do breath work and exercise and do this, but it's like condensing it and doing little bits every day instead of trying to hit the gate running, and doing too much all at once and not being able to keep up with it, the consistency of it. And I think that's a big important thing for people to understand. It's not about overdoing the things, it's about implementing like simple routines that allow you to do them each and every day. Like my magic morning routine, my clients do before they even get out of bed, and it's a little bit of breath work and meditation, and they say some affirmations or some things they're grateful for to get that energy, that good positive vibration flowing. And that takes 5 to 7 minutes every morning. And they say it's an incredible change from their nervous system feels so regulated from doing it after a week, because instead of them sitting down and like, I have to do this and it's like a chore, it becomes something they look forward to and can easily maintain.
Absolutely. That's why there's this big trend for, like, what they call movement snacks. So it's
Oh,
like you
yes, I've
have,
heard
yeah,
that.
yeah. So I'm a big fan of movement snacks. That's how I operate. Because even in
Yeah,
my clinic, in between patients, I'm doing my little movement snacks.
a
And that
hundred
just means
percent.
like throughout the day, you're just having these little bites of movements. Like, oh, I'm going to do a back bend here. Oh, when I'm washing my face, I'm going to massage my fascia. So you just have all these little movement snacks throughout the day. And those
Yeah.
have shown to be greatly beneficial to your overall well-being and also reducing injury.
It's so true. It's like people are so sedentary. And even if you're like able to go for a 10-minute walk after your meal, you're helping to digest your food. You're giving your brain like a little break instead of, always thinking about the next thing, to just take that moment and go move your body.
Absolutely. And then, like
Yeah.
you said, like your morning meditation, like those kind of things, if you're incorporating them and they become habits in your life, those are
Yeah.
really the building blocks of healthy aging.
Yeah. Agreed. If listeners could take away just one message from today's conversation, what do you think that would be the most important thing they need to know about their health in their 40s or and beyond?
I would say two little things. Like number
Yeah.
one, like you have to have boundaries, and that's
Mm,
boundaries with other people so that you can focus on yourself. If
yeah.
you focus on yourself and your well-being, everything else in your life will be better. So really
Yeah.
focusing on yourself and stretching. You need to
Agreed.
stretch. Because I
Yeah.
mean, people don't stretch because they're like, aesthetically, it's not as motivating because you're not going to get a six pack from stretching. Actually, you will, but
Exactly.
yeah. So like, just stretch and set boundaries, and you'll be so much better.
I love that. It's so funny too because people like don't want to stretch because they're like thinking, like you said, I'm not going to get abs from doing this. I'm not going to. That's so like wrong because those are the things that help your body to relax and to and it's not about the over exercising and beating your body up that's going to give you abs. It's the nutrition, and that feeds your cells, your fascia, your like organs, your brain, your everything,
Exactly. And if you're stretching,
right?
the fascia is going to let go of the fat, right? So like, you
Exactly.
stretch. It also has aesthetic benefits too.
Yeah, agreed. Um, and so, quick rapid fire questions. Morning routine must have.
I do a back bend every morning.
Back bend.
Yeah. So when I get out of bed, I go and do a back bend, and that's how I take my first step out of bed.
Oh, I love that. And why the back bend?
Because with our modern day posture, we're just forward so
So
much.
forward.
So if you're a sleeper who tends to curl up while you sleep,
Yes.
you want to do a reset and start your day off an extension, and it will make an immense difference for your posture.
I
So
love
I
that.
do it back then.
Question about the sleeping thing. I just thought of that. It's funny. I wrote that on my notes and I forgot to talk about it. So you see when all of these again on YouTube ads and stuff where they're saying if you sleep like with your arm up and your leg out, do you see those ads
Yeah, yeah.
that's not good?
Yeah, I mean, the thing is, there are certain ways that you can sleep in order to have spinal alignment. So, like,
Right.
if you're on your side, you want a pillow between your legs, because if your sleep all splayed out, your spine is actually in rotation
True.
overnight. So, essentially, the proper sleep position maintains your spine in alignment. So, if lying on
Okay.
your side, your pillow should be between your shoulder and your knee. You should have a pillow between your knees, or if you're in a back, you want a pillow under your knees so that you're not putting pressure on your lower back.
Right. I always sleep with a pillow and I put my arm around it so that my arm's not like hanging down like that. It's
Yeah, you
always,
don't want it rotated in, right?
yeah, it's so true. Best exercise for longevity.
I would say walking.
Yeah,
Walking is the best
agreed.
exercise you can do, and that will keep you. It's good for your heart, good for your legs, good for your hips. Walk.
I couldn't agree more. Biggest posture mistake.
Looking down. People spend all their time looking down, and I'm like, when you're looking down, you're literally doing this. Stop looking down. It's a
Yeah,
waste. Like, stop looking down. Don't look down. Don't keep your phone down. Don't keep your book down. Don't look down on the street. Like, just stop looking down.
100%. And that's another thing too. I had a car accident at one point and I hurt my neck and now I can't like if I'm on my phone and I'm doing this, I'll instantly my neck's like, oh, so I don't even do that anymore, which has helped me stop doing that
Yes.
because I could feel like the shoulders starting and the back of the neck starting to just get all tight. So now I'll try to like keep things up here instead of being down like
Which is
this.
good. Yeah. Looking down is bad. Don't do it.
Yeah. And foam rolling, yes or no?
Absolutely. Yes. It releases the fascia.
I was going to say, I need to start foam rolling more.
Yes.
Most underrated wellness habit.
Most underrated wellness habit. I would honestly say stretching. Like, I feel like it's
Yeah,
so underrated. Like, it
100%.
deserves more than it gets.
It does, I agree. And one thing women should stop doing immediately and start doing immediately.
So they should stop saying yes to everything
Yeah.
and start saying no a lot more.
Hmm.
Let me tell you, like, the thing
I
is,
love that.
you don't have to get stuff out of your fascia if you don't store it in your fascia. So the biggest way to not store it in your fascia is just say no and
That's
stop
right.
saying yes so much.
It's funny. I have a friend, and she's like an entrepreneur, a mom. She's so busy, and she's always got people wanting to like do dinner and do these meetings and do that. And I say to her all the time, just say no. You don't have to go to all of these things you're invited to. And I know it's nice to support friends and support businesses, but you are more important than any of them, you know, and they'll understand if you are feeling overwhelmed and you've got a lot on your plate.
Absolutely. You have to decide what you actually need to do and just, don't let people waste your time.
No, exactly. And so, last thing, and I could talk to you for hours. We'll have to do another one, like a part
Yeah.
two. So your shoe line, compression socks, and purses. Let's talk about that for a second.
Well, I mean, the shoes, they're all orthopedic, so they're designed to support healthy alignment, your posture. Compression socks are just great for lymphatic drainage, right? So
Yeah.
it helps with bloating, it helps with foot pain, it helps with ankle puffiness. Like everyone should be wearing compression socks, especially when you work out, especially when you're traveling, if you're standing on your feet for a long time. If you
Right.
sit at a desk, you should be wearing compression socks. And my bags, they're great for your posture because they're all ergonomic, because that's actually a big cause of neck, shoulder, and back pain is women
Yes.
carrying their bags,
A
and it literally
100%.
alters your posture. So wearing an ergonomic bag or a backpack is a great way for your alignment and your fascia so that you're not straining it.
I love that. And where can people look at your shoes, your bags, your socks? Where can they go and order stuff?
So that's drlizashoes.com.
Dr. Laws, and you can get the socks and the purses on there
You
as
can get
well.
everything you need there.
Okay, I'll get you to text me that, drlizashoes.com. I think I got it, but DM me that so when I post this on the grid, the live, and I'll put your information where they can find you.
Absolutely, and you can
Also,
tag Dr. Liza Shoes too. We're
oh,
on Instagram.
perfect.
Yeah.
Okay, perfect. And so, where can they find you if they want to learn or connect with you about fascia release, the facial, the body, the emotion, all the things, all the services you provide?
So everything about me and like where my clinic is, I have a blog, I have educational
Okay.
resources. It's all at www.dr-liza.com.
Amazing. Oh my God, it was so amazing having you today. I loved our conversation. I know so many people are going to benefit from this. And I know you're probably going to have your door get knocked on from people because I've already seen messages coming in. Oh my God, what is this? How can she do this? Can she help me with this?
I can, yes.
So I will send them all your way, and we will follow up in the near future because I think I'm going to book some appointments myself and take you guys with me. And yeah, thank you so much, Dr. Liza.
Okay, thank you,
We
Karla.
will chat soon and have an incredible rest of your day.
Okay, you too. Okay,
Thanks,
bye.
Henny. Bye.